Let's talk a bit about what happens if you don't address the nerve problem or the numbness. We get a little bit of numbness in our feet. We can live with that, we think, but it's going to progress. Peripheral neuropathy is a progressive disease. It's going to get worse. Pretty soon, the numbness can turn into pain, which keeps you awake. It keeps you from thinking clearly. That pain can move up to your knees. Many times it starts in your toes, but then it moves to your fingers. Now you can't hold a fork correctly. You're a little dangerous driving. Since it is in your feet, you can't feel the pedals. So it's going to get worse and worse. It can actually go into another form of neuropathy and affect your organs. And now your organs start to not pay attention to signals from the brain. The brain controls everything. So if it doesn't say get enough blood to your liver, then your liver can't function as well. Ignoring the symptoms does not help. Masking the symptoms temporarily does not help. You mask it, the background problem continues to grow. So if you are deciding that you want to do something about that, what's your choices? Well, you can buy a little $60 machine from Walmart, a TENS device, and it overwhelms the nerve signal so the brain doesn't even get it. It's kind of like if you have a headache and a stomp on your foot, you don't pay attention to the headache anymore. You pay attention to the new signals that you're getting from your foot. The other thing is you can get drugs, heavy-duty drugs, gabapentin, Lyrica, that kind of stuff, and those all have side effects, and they only slow down the signal. That's all they do. You can take an aspirin sometimes. That can help. Meditation can help, and that really can actually help. Reducing your stress can help. Increasing your exercise so that you get more blood flow to your nerves, that can help. I much prefer a holistic approach. Surgery can help if you have an absolutely damaged nerve, like a crushed nerve. Then sometimes we can cut the nerve in the spine, that particular part, so that that really garbled signal that's never going to be corrected because the nerve is smashed doesn't get to the brain. But that's a very unusual situation. The simple answer is to watch what you eat, lower your stress, see if you can get some more sleep, and use the rebuilder to rebuild those nerves. The rebuilder can restore those nerves because it's like a pacemaker for the nerves. Pacemaker for your heart reads the electrical signals, and if your signals go into fibrillation too fast, it can bring them down. If your heart signal is too low, then it can, it's called bradycardia, it can bring up the speed of the signals. It doesn't really affect the waveform, but affects the speed. The rebuilder is like a pacemaker for your nerves. It reads the health and the output signals of the nerve itself, and it sends a compensating signal to correct it, and it's lasting. Many times the nerves just need to be coaxed back into a good position. One of the examples I use sometimes is when you have an itch on your back. You have an itch, and it's always in a spot where you can't reach it. So you ask your partner, say, will you scratch my back for a second? Yeah, left, okay, up, yeah, oh good, left, down, right there, yeah, right there, oh yeah, that's good, fine, stop. If they continue, it moves into pain. That's what happens with a TENS device. It can temporarily solve the problem, but it doesn't know when to quit and causes pain and permanent damage. So the rebuilder acts like that feedback. Go left, go right, go up, go down. Okay, that's enough, stop. The rebuilder analyzes all of that in real time and makes those adjustments so that you don't really have to do it. It's a 30-minute treatment. The patient who uses it at home in the morning and uses it at night. At night, it also releases endorphins, which helps them sleep. Get to sleep faster and stay asleep without even sleeping medication. And then go about your life so that you have health, wealth, happiness, and particularly happy nerves. So thanks for watching.